This is a topic that both Ted Rosen and I have worked on a lot together and separately, and are very interested in the concept of antibiotic use in dermatology. It's something that we hear about, antibiotic resistance issues, and this term, antibiotic stewardship, but really how does it relate to dermatology, and that's what we're going to be talking about. We broke it up into two segments. I'm going to do a general overview, and Ted's going to talk more specifically about things other than acne and rosacea, but I'm sure he's going to touch on a lot of different things. I do work with a variety of different companies that have antibiotics or have something that is related to the microbiome or the microbiologic world, and learn a lot from a lot of the people at these different places. Okay. So the pressure to prescribe antibiotics more judiciously, there's been a tremendous effort on the part of government agencies, medical groups, and even the lay public with regard to prescribing antibiotics more judiciously. And what does that mean? I mean, it's easy to say that. What does it mean? The Food and Drug Administration made changes to antibiotic product labeling other than drugs used for tuberculosis in 2004, but they weren't even thinking about dermatology. Dermatology was not on the radar screen with the way that we often use antibiotics for things like acne and rosacea. They were thinking specifically about the same thing that the Center for Disease Control was thinking about. Patients that during the wintertime, they have flu-like symptoms, they go to urgent care or primary care or wherever they end up, and they get antibiotics when many times they don't even have a bacterial infection. And that's engendering resistant organisms that spill over and create problems with antibiotic resistance. That was their thought process. But at the same time, we in dermatology write antibiotics more per practitioner than any other group of physicians or group of clinicians. They look specifically at different doctor groups when that was looked at. So we kind of fell below that radar screen. This past year, and Ted was involved in this, we had the scientific panel on antibiotic use in dermatology, and we'll have a publication coming forward within the next 6 months or so from that group getting together. Was the first time that the CDC came forward and said, you know, we're just starting to look at what's happening in dermatology and how you actually use antibiotics, and we recognize it's very different, that very often it's for diseases that are chronic where you're not necessarily treating an infection. So we're trying to work with them to look at what are better ways to track the information and what are some options to utilize things other than antibiotics or use antibiotics less frequently or for shorter durations and still get therapeutic results. It's easier said than done.
And the last thing I want to mention is that this is a global problem. It's not just the US. 5 out of 6 of the World Health Organization they have regions, reporting regions, have over 50% of their staph isolates are MRSA. Over 50%. 5 out of 6 reporting regions. So this is a worldwide problem with potentially really, really bad consequences. Do keep in mind, there may be different strains. That's why we classify them. And we can also do epidemiologic tracing and see where these strains are going, where they are becoming predominant. But for right now, this has been fairly stable for quite some time.